Good day, everybody. Welcome back to my channel. My name is Damilola. I'm a mom who loves to share tips on how to better understand our babies so we can worry less. To all our returning subscribers, thank you guys for coming back. We really do appreciate you. You guys are the real G's, man. And to all our first time subscriber or viewer, thank you for coming. We're so glad to have you here. And please, if you've not subscribed, do remember to subscribe. Click on the notification bell so you know anytime we drop a new video. Yeah. Today's video we'll be looking at teething. Symptoms of teething. How will I know when my child starts teething? When to call the doctor. Actually, we should not mistake some symptoms for teething. When to call the doctor and how to suit this teething process. So let's dive right into the video. So number one is that children are irritated. Like, they can just be very irritated. They don't want normal thing, like you play with them and they accept it, and they just don't want it. They just stay away from me. I don't want you. I want just my mommy. Leave me alone. They can be like that. Yeah. So my daughter was, don't carry me. I want my mommy. Mommy, where are you? They can just be irritated over little things like that. Two, lack of sleep. Like, how does lack of sleep affect them? Because they are not comfortable. Yeah, I can say it. Like, I remember a couple of years back when my teeth here were growing and I knew how much pain I was going through. So I can understand how much pain they are going through, as in when they are teething, the pain they are going through at that point. They don't even want to eat. My daughter was on that table. She doesn't want to see her food. The only thing she was taking was mommy's breast milk. She doesn't want to see her food. As you are making the food, she's playing with the plate. But once she realizes that you want to give me food, she pushes it away, like, go away. I don't want to go. So they don't want to eat. Then this is the one everybody knows. They have itchy gum. Their gum gets very itchy. For most children, that's the point they start looking for hard object. If it's the child that engage well with her teacher, she start putting it in his or her mouth and start chewing. Most times they prefer something very solid. My baby really doesn't put things in her mouth like that, except they are very juicy. So she would either take mommy's hand or daddy's hand or anything very solid that is not squishy and put in her mouth and try to chew. And if you take your hand away and she notices you are not responding, she start grinding on her gum. Like, she does things like, she does that a lot. And I'm like, why are you doing this? Before I actually realized it was the teething process that made her grind on her gum like that. Then check if is their teeth swollen. Their gum, at that point they tend to have a swollen gum. This gum is a little bit more swollen than before. Then teething is on the way. Then they start pulling their ears. My baby didn't really pull her ears, but she did something like this instead, and they start rubbing on their gum. That way the gum is hurting. Everywhere is hurting. They are just looking for ways to suit the pain. Like, will I pull it? Will it get better? If I do this, will it get? They just finding ways to suit the pain. Then there's this thing in Yoruba, like, some people like, you and this Yoruba people, I'm sorry, that's my tribe, so I know quite a bit. They tend to say your child is spitting a lot because of the teeth. Like, this is what they say, ito eyin. Verbal translation, spit of the teeth. It's true. When your child starts eating, they tend to drool a lot. You see them drooling and like, this spit wasn't this much last month. Why is it like, why are you drooling a lot this month? Teeth is on the way. And this drooling tends to increase at around 3 months, 4 months, and that's the time the active process already starts. Normally the process starts from the womb, but now for us to see the physical teeth and everything, this process starts at around 3 months. 3-4 months. Some children at 5 months you've seen their teeth, 4 months you've seen their teeth. Some go through the normal time, 6 months and above you start seeing some children's teeth. So it's still a normal thing. Then slight temperature. I do not say temperature generally. Slight temperature. Your child might just have quite a bit of temperature because the stress. Oh God, I remember when my teeth was growing. Oh God, I could not talk. I just please let me bring that. So imagine a child that can't express what he or she is going through that kind of pain. There's no way they will run temperature, but not very hot. My baby had temperature, but it was not the heavy temperature and all. Now this one will now lead us to when you should call the doctor. So before I go dive into this, now I'll say the reason why people take these symptoms I'm about to mention now, link it with teething, is because teething tend to start at around, as in children tend to show physical signs at about 6 months, and that is the time whereby the extra antibodies they got from their mom through the placenta is starting to wear off, and they are starting to build more of their own personal immunity at that 6 months. So because of this, there's this slight gap, and it's an opportunity for any infection or anything that wants to enter to just dive in. So if you notice your child is having serious temperature, now not slight temperature, serious temperature that his or her body is scorching hot, call your pediatrician, call your doctor. Or if they're having cold, catarrh, runny nose and serious cough, call your pediatrician. It is not teething that is making them have it, or they're having diarrhea. Now remember that their gum is itching and they are looking for everything possible to put in their mouth to help soothe the pain. So they might have taken something that is quite contaminated and they ingested it. This could lead to diarrhea. Something you ate could make them have diarrhea. So if your child is having diarrhea, check what they've eaten, because I know at this point you're already giving them complementary food. Check what they've eaten. If you can't associate it to something they've eaten, that means they must have put something in their mouth. Call your doctor, especially if it lasts more than a day. Because if your child is having diarrhea, they are losing water. They are losing water, and dehydration is not good for your child. So if your child is having serious temperature, having runny nose, cough, serious cough, call your pediatrician. All these things I've said, people tend to attribute it to teething, but it's the fact that their antibodies are a bit low at that time that give chance for all other infections to come in, and we tend to mistake it for teething. I know of a baby that at the end of the day, she ended up in the hospital for like 2 days to be treated properly, because she was not, the case was something else. So if your child's temperature is really hot, see, I'm emphasizing, I love babies, I don't want them to fall ill. If their child's temperature is really hot, serious cough, catarrh, that's nostril, and diarrhea, put a call through to your pediatrician. Please, I'm begging. It is not the teeth that is making the child that hot. So saying that, how do I help my baby go through this process? You could give your baby simple pain relief, and you could also ask your pediatrician how to help suit this situation. There are some things you could put on their gum to help reduce the pain, like just to numb it, and just those chemicals, I'm not really that interested. But you could also use this. Make sure the cloth you are using is clean. Make sure it is wet. Put in the freezer. Make sure it's very cold, like very cold. Then place on your child's gum. This will help soothe that pain, because the gum might be warm. So once you put it on it, it gives you this cold relief. I remember my baby will be taking cold, because I take cold water, and she put it on her mouth. She just was satisfied with it, and okay, this is what was happening then. So please, if you notice the first symptoms I mentioned, stay calm, your child will be fine. But if you notice those other 3 symptoms, let me repeat: high temperature, as in very high temperature, runny nose and serious cough, diarrhea, call your doctor abeg, so that you won't have to overstress yourself. And at the same time, during this period when they are teething, please watch what they put in their mouth. So during this period when our babies are teething, please watch what they put in their mouth. Very, very important. Watch, because that's where most of the illness starts from. And once your child is ill, as a mother, you won't be balanced. Please watch them. So if you find this video interesting, educative, informative, please give us a thumbs up, and also go to the comment section and please share your experience. Till we come your way next time, keep taking care of your baby, yeah, and also keep taking care of yourself, because we need a sane you to take care of our little angel. Bye bye.